So, how is a heart attack different from a cardiac arrest?
Cardiac arrest, na, basically what you're telling people, what it means is that the heart is not
How different are heart disease symptoms in women compared to men?
pre-menopause varaikku oralavukku people are okay, but then perimenopausal and post, the protective ring is gone, the shield is gone. A lot of people don't know they're diabetics. People just don't want to have a regular doctor that they have checkups with.
So, what is a heart attack exactly?
Like what we see in movies and this and that, நெஞ்சு அப்படியே பிடிச்சிட்டு அப்படின்னு விழுறாங்கன்னா அதுக்கு காரணம் is most likely.
Welcome, Dr. Arun.
Thank you very much.
Dr. Arun is the director and head of cardiology at ProMed Hospitals, Chennai.
He's associated with many leading hospitals globally.
He's a global proctor for chronic total occlusions at Boston Scientific,
Abbott Vascular USA,
Medtronic China,
Spectranetics,
Asahi,
Intech USA,
and he's also a director at Fortis Escorts Hospital, New Delhi.
So, how early should we start worrying about heart health?
As we get older, I think the proportion of patients that we treat that are younger than us is actually, it's a very scary thing, right?
Is chest pain the only sign of a heart attack, or is it just the most quoted one?
Who have actually walked in, not feeling right, and I don't know them, they don't know me, they've just walked into the hospital. So they're like, ECG shows like, okay, this is a heart attack. என்னங்க நடந்து வந்தாங்க heart attack ன்னு சொல்றீங்கன்னு.
So, how do I know if I'm having a heart attack or not? What should I do? And most importantly, what should I not do?
Okay guys, this is the most important question.
தமிழ் படத்துல எல்லாம் வந்து இப்படி பண்ணுவாங்க, then you have to blow into the mouth to mouth resuscitation கொடுக்கணும் அந்த மாதிரின்னு. Now it's just
it's been like, I think abused,
Yes.
whatever. There's a lot of I think myths around CPR.
So, what are the risk factors for heart disease?
Vaping, smoking should be out the window. Diabetes, big one.
எல்லாரும் சிகரெட் பிடிக்கிறாங்க, தண்ணி அடிக்கிறாங்க, அவங்களுக்குலாம் ஹார்ட் அட்டாக்கே வரது கிடையாது. இன்னும் வேற என்ன, நான் நல்லா தானே இருக்கேன், எதுக்கு என்ன மாற்ற சொல்கிற? ஸோ ஒயிட் கோட் ஹைப்பர்டென்ஷன் எனக்கு வீட்டில் பார்க்கும்போதுலாம் நார்மலாக இருக்கும், டாக்டர் கிட்ட வரும்போது மட்டும்தான் ஹையாக இருக்குது.
Seeing the doctor makes people stressed.
So we don't wear white coats nowadays.
நம்மளை பார்த்து எதுக்குங்க ஸ்ட்ரெஸ் ஆகிறீங்க?
ஜிம்முக்கு போகணுன்னு அவசியம் இல்லை. ஜிம்முக்கு போகிறவங்க எல்லாம் they suddenly dropping deadன்னு சொல்லிட்டு காமிக்கிறாங்க நியூஸில்.
It's very important because a lot of people do ask about this, right? டாக்டர் ஜிம் போகிறதுனால தான் சாகுறாங்களா?
Sunflower oil, heart healthy.
In general, all oils are bad.
Sleep, is it important for a healthy heart?
Yep.
Oldest patient you have successfully treated?
102.
Wow. Hello and welcome to Femiliarise. Let's get the conversation started. Today's episode is going to be a very, very important one. There's an organ in your body that never takes a break. It works tirelessly from the moment you're born till your very last breath, beating around 100,000 times a day, nearly over 3 billion times over a lifetime, powering life without asking for much in return. Yet, most of us take this tireless little powerhouse for granted until something goes wrong. Just the size of our fist, but it adapts silently when you climb stairs, get excited when you fall in love, and sometimes even races when you're just anxious. It is strong, responsive, and remarkably dependable. But here's what's most fascinating about it for me. For something that's constantly serving every cell in your body, it never forgets to serve itself first. Before sending life-giving blood from head to toe, it sends a portion to nourish itself through tiny vessels called the coronary arteries. Because it knows that you can't pour from an empty cup, not even if you're the heart. So today's episode is a reminder, a wake-up call, and maybe even a lifesaver. We are going to understand this unsung hero a little better, listen to what it's been trying to tell us, and most importantly, learn how to take care of it before it decides to go on strike. So welcome to Mission Unblockable, saving hearts one artery at a time. To help us unravel the mysteries of the heart, combining lifestyle with life-saving insights, so we have with us a world-renowned interventional cardiologist, Dr. Arun Kalyanasundaram. Welcome, Dr. Arun.
Thank you very much for the kind introduction, Dr. Priya.
So how early should we start worrying about heart health?
So it just goes with with the old saying, right? An ounce of prevention is worth a pound of cure. So earlier the better. I think from your 20s, you probably should pay attention to your heart for sure. And so I would say 20
Starting
is probably
from
the right
20s.
time.
So are you really seeing heart disease even in the 20s nowadays?
Unfortunately, yeah. Yeah. I mean, as we get older, I think the proportion of patients that we treat that are younger than us is actually it's a very scary thing, right? Like, in fact, 2 weeks munadi we had this run of patients with heart attacks, 34, 36, and then there was another one who was like 40, had just turned 40. So it's kind of
Getting earlier.
scary. And I mean, over the years, I mean, we've seen a lot of patients, especially I think the Indian subcontinent, a lot of them in their 20s too.
So the sooner the better, and heart disease and heart attacks are no longer only restricted to a disease which affects older people for sure. So is chest pain the only sign of a heart attack, or is it just the most quoted one?
It's the most quoted one. So I'm glad you actually brought this up because an often asked question is like, hey, can you tell me if this is cardiac or not, just based on symptoms? Unfortunately, the answer is no. So I'm sure in med school we have all learned the classic, the describe the pain, location, radiation, aggravating relieving factors. So chest pain in general, the typical thing, ache, pressure, dull, these are all adjectives that are used. General center of the chest, towards the left side, left shoulder, right shoulder, jaw, in the mari. This is the classic symptom. Anal, this is very rare. I mean, I shouldn't say very rare. It's definitely not the most common presenting symptom. For most people, it's about மூச்சு வாங்குறது கஷ்டமா இருக்கு, heartburn, நெஞ்செரிச்சல், just feeling very fatigued. I don't feel right. பயங்கர களைப்பா இருக்கு. So it could be like a constellation of symptoms that are not typically associated with the heart.
So that's scary because most of the people we see day in and day out in the OPD have the sense of fatigue, feeling tired all the time, probably because they are not sleeping more, acidity, bloating, indigestion. So we really do not know whether there was a symptoms associated with indigestion or really with the heart unless you really check for it.
Right. And I mean, I would say the caveat being that, okay, if you're always fatigued, you're not always having a heart attack. Yeah. But let us say you have one day when you just don't feel right, unusual, right? Like it really hits you. So those are the kind of symptoms that you should be worried about. And of course, this thing about the GI, is it gastrointestinal related or heart anger? It's extremely hard for people to diagnose unless you do ECGs and blood tests, etc. So err on the side of caution is what I would tell people.
And don't self-diagnose it.
Yeah.
And just take a Gelusil and decide to stay at home.
Yep.
And write it off. Okay. How different are heart disease symptoms in women compared to men?
So, yeah, I mean, in fact, I think it was at your meeting that we actually did this poll of like, what do people think is the most common reason why women die, right? I mean, I think surprisingly that it didn't turn out to be heart disease, but the reality is it is heart disease. So it's not just a man's disease, it's very much a woman's disease too. And especially after the protective effect of the premenopause, people are okay, but then perimenopausal and post, the protective ring is gone, the shield is gone. So definitely it's the number one killer. And the other thing is women globally are under-recognized, they are under-treated, they get less invasive procedures for a lot of reasons. And the India phenomenon,
also, right?
I'm sorry?
They are understudied.
Yeah, in research, they're underrepresented. It's kind of it's very sad, actually, I used to pathina. And to just top it off, women also have more atypical symptoms. So they're, you had asked about what are the common symptoms, right? They're more likely to present with fatigue, shortness of breath, etc., than the classic chest discomfort radiating to the left arm.
Usually, typically, women are protected in the premenopausal phase due to the protective effect of estrogen, as you pointed out. But nowadays, compared to before, are you seeing an increase in the number of heart attacks or heart disease at younger ages in women also?
So I would say in general, again, take it with a pinch of salt, there are always exceptions in medicine, as I'm sure our audience is pretty well aware of. Uncontrolled diabetics, right? That's the one thing that a lot of people don't know they're diabetics. They have some, the gestational diabetes, hypertension, then they're like, yeah, I'm fine. So in their 30s, they don't really think about their own health, and their first presentation, unfortunately, sometimes is a heart attack, and then they're like, "Okay, I have no disease. I'm fine. How did this happen?" But then, like, you do your blood work and everything, and then they end up having a hemoglobin A1C of like 12, and I'm like, "Did you know this?" They're like, "No." So often it's with diabetics.
And both in men and women, we know that India is the diabetes capital of the world. And as you rightly said, there's a lot of underdiagnosed or not diagnosed diabetes around. And but on the other hand, the people who have diabetes, who know they have diabetes, they're not that bothered about their blood sugar control at all, which I find shocking just because they are young. They think, no, there's no chance I can start on medicines and be on medicines lifelong. So they try all sorts of, at least if they were trying lifestyle modification and achieving control, that's okay. But many of them do not check their blood sugar values at all for months, even years, and then they do land up with complications. So do you come across such patients?
So this is the one thing that I emphasize on, and I mean, and I know that you're also into lifestyle, and it's super important that we do all the preventative stuff in order to reduce the overall disease burden and the chance of bad things happening. Now, that being said, I think if there's one humble request that I would like to kind of put forward is, please get a primary doctor. Like, I don't know, it almost seems like a stigma or whatever reason. People just don't want to have a regular doctor that they have checkups with, right? It's like in fact, my standard rule is I will not see you unless you have a primary doctor. If you don't have one, I will get one for you, but I cannot be your primary doctor. I think access to specialists is a double-edged sword. So many times, I always tell people, the more specialized you are, you end up having tunnel
narrow.
vision. Ilya. So it's very, very important, especially in the NCDs, especially diabetes, hypertension. You need a good internist. You need good people to manage that, and you need to take control of it as a patient. And it's a partnership. It's not like, I think most people don't want to hear stuff, but I think at least the current generation of good internal medicine doctors, you talk to your patient, you figure out what works, try lifestyle, but take ownership of the disease, but work in conjunction with someone.
Okay. Because I think, as you said, family physicians are the need of the hour, and nowadays it's getting to be only specialities and super specialities, and everyone looks at their part of the body, and then really no one treats the patient as a whole. So I think having a good family physician is very, very essential. So, what is a heart attack exactly?
Okay, the million-dollar question. A heart attack is, you already talked about how the heart, in a way, kind of takes care of itself and then supplies blood to the rest of the body, right? And the blood vessels that supply blood to the heart are called coronary vessels. Now, a sudden blockage that develops in the coronary vessels is a heart attack. So, yeah.
So, what happens? There is a sudden blockage.
So
in
there
the-
is a sudden blockage, and this is because of a blood clot. So the underlying, there is this plaque அப்படின்னு சொல்லுவோம், right? There is this stuff in the blood vessel, which comprises of a lot of things, and அதுக்குன்னு ஒரு anatomy இருக்கு, as you're well aware. There are macrophages, fat cells, this, that, cholesterol deposits. There is a cap on top of it. Typically, there is what we call, there are multiple ways this can happen, but the most common kind of heart attack, let's talk about that, is when the plaque ruptures. So the best analogy that I can think of, and what I often use to explain to patients, is think of a volcano rupture, like, erupting. Adhe madri, the plaque ruptures, and the body tries to close it off, and then ange platelets, adu idella vandu deposit ஆயிட்டு, unfortunately, அது ஆகும்பொழுது it kind of blocks
whole vessel.
the vessel itself. So இதுதான் heart attack.
அது ஹார்ட் அட்டாக். அப்போ அந்த வெசல்ல blood போகலல்ல, அப்போ என்ன ஆகும்?
ஹார்ட்டை பொறுத்த மட்டும், and in fact நம்ம உடம்பை பொறுத்த மட்டும், right? Everything needs oxygen, and the way you get oxygen is through blood. Blood vessels, the arteries ஓட வேலை is to take the blood. So இந்த மாதிரி, like when there's a sudden cessation of blood flow, that part of the heart muscle is dying. இப்போ the first thing, right? If that part of the heart muscle dies, no vechupome. So what happens is that normally pump பண்ற heart அந்த பகுதி பண்ணலைன்னா it can result in heart failure, etc., etc. The most common reason why people die in a heart attack is not because the pump just fails. It's for most people there are three major vessels: right coronary artery, left main divides into left anterior descending and circumflex. இந்த மாதிரி அந்த ஒரு say ஒரு எல்ஏடியில் ஒரு அடப்பு வந்துச்சுன்னா அந்த பகுதி of the heart muscle is dying, right? So usually என்ன ஆகுதுன்னா heart also has an electrical system, right? We talk of it as a pump. Valve இருக்குன்னு தெரியும், அதில் அந்த pump தெரியும். But there's also a cadence with which the heart pumps. So அதில் ஒரு SA நோட்னு ஒன்று இருக்குது. ஸோ எலக்ட்ரிக்கல் ஆக்டிவிட்டி அதனால தான் ஒரு சிங்க்ரனைஸ்டாக அந்த பம்ப் வேலை செய்யுது. அந்த வேல்வ்ஸ் அது இதெல்லாமே அதனால தான் வேலை செய்யுது. ரத்தம் போகாத போது like when there's no blood, it gets irritated. The muscle gets irritated. ஹார்ட்டை பொறுத்த மட்டில் ஒரு செகண்ட் மெயினாக எஸ்ஏ நோடு இருக்குது, அப்புறம் ஒரு ஏவி நோடு இருக்குது, அப்புறம் எலக்ட்ரிக்கல் சிஸ்டம் ஃபுல்லாக இருக்கு இல்லையா? எலக்ட்ரிக்கல் சிஸ்டம் ஸ்டார்ட்ஸ் கோயிங் haywire. So that can result in some really life-threatening rhythm problems such as ventricular tachycardia, ventricular fibrillation. Basically, கீழே இருக்கிற மெயின் பம்ப் சேம்பர் வந்துட்டு instead of pumping in a synchronized manner, it starts doing this like a bag of worms. And அந்த மாதிரி பண்ணும் பொழுது there is no effective blood outside, so it doesn't pump. So within minutes people can die. So like what we see in movies and this and that, நெஞ்சு அப்படியே பிடிச்சிட்டு அப்படின்னு விழுறாங்கன்னா அதுக்கு காரணம் is most likely ventricular tachycardia or fibrillation.
So how do I know if I'm having a heart attack or not? What should I do? And most importantly, what should I not do?
Okay guys, this is the most important question, right? Like literally, if you think you're experiencing a heart attack or a loved one is experiencing a heart attack, first thing is don't take chances, right? If you have an aspirin, take a full like 325 milligrams of aspirin. Say someone like cholesterol medicine or say rosuvastatin or atorvastatin, take a full dose of that. And
Full doses?
So 80 milligrams of atorvastatin. If it's rosuvastatin, it's 40. So take that. But aspirin is like the single most important one. And don't wait on it. Like, if it's lasting for a few minutes, no vechukongla. So first thing is, how do you know? New symptom. So if you always get heartburn, like, நான் 3 மணிக்கு நான் சாப்பிடலன்னா எனக்கு பசி வரும்னு தெரியும், அது மாதிரி இருக்குன்னா, it's a consistent symptom. அது இல்லை. This is a new symptom it's usually pretty telltale. It's bothersome. Anywhere from your umbilicus to your jaw or like, angle of the ear. ஒரு symptom வந்திருக்கு, ஒரு few minutes last ஆகிட்டு இருக்கு. It can be a heartburn, it can be, pressure, it can be any symptom. மூச்சு வாங்க, you're feeling like ரொம்ப மூச்சு வாங்குது, something like that. Shoulder, whatever. It doesn't go away within a few seconds. Like ஒரு செகண்டுக்கு வந்துட்டு போச்சுன்னா, usually you can say that's not your heart, right? But it's persistent, right? It's lasting for a couple of minutes. Take this aspirin, atorvastatin, and please go to the nearest hospital. Don't drive. Please have them go. Or if you have ready access to an ambulance, this, that, whatever. Ideally, as you know, Western countries, you call 911 or whatever is the area code. The number. But quickest way to the hospital, adhan panano. Second thing, don't drive.
என்ன செய்யக்கூடாதுங்கிறது, don't drive and don't sit at home and think that it'll go off on its own. Even recently now, just 2 days ago, I had a pregnant woman. She's 17 weeks now. So she came and just wanted to check the baby status because suddenly they lost a dad, and then he didn't have any other NCDs, history, edume illiya, hypertension or diabetes, or maybe it was not diagnosed as you have pointed out earlier. And anyway, he didn't have history of any other medical disorders. And காலையிலேருந்து கொஞ்சம் ஒரு மாதிரி, as usual, he had some sort of indigestion, but he was otherwise okay, drank something, felt much better, talked to her over the phone. And then suddenly he just threw up and then collapsed. They brought him to our hospital, which was the nearest for them. But then when they brought him itself, he was pronounced dead on arrival. So again, because she was rightfully very upset about it, they wanted to check the baby status. So this is something which is very commonly seen, right?
So yeah, unfortunately it happens a lot more than it should. So the key thing is paying attention to your body and its symptoms, right? I think that's really, really important. And something that's very interesting and actually has been published in many times before the actual, like the big event, right? It's literally like a volcano. Like Nariya Vati Poninga, I mean, we have all seen volcano eruptions, this, that we have read about it, watched
Read
on
about
TV.
it, not
Or,
seen
I mean,
it.
like at least on TV,
Okay.
on TV, right? Like,
Okay.
or on YouTube, you can always look it up.
Yeah.
So, Palamura, there are warning signs. Somebody, you know, it tells you, hey, something is not right. So, what they've actually shown is that a lot of patients actually do have these mild symptoms up to actually a month before a heart attack. So, yeah, like, yeah, okay, fine. Say, Seriya Butcher. Then again, you know, it keeps doing that. So many times before it actually happens, you kind of have kuti warning symptoms. So my point is like, you know, pay attention to your body. And yeah, we all like to be optimistic. We don't, you know. And I think overall there is a fear that நல்லா இருக்கும் டாக்டர் கிட்ட போனா ஏதாவது சொல்லிடுவாங்க. So that's
Definitely, yeah, I
there a
know.
lot.
That is there.
So
ஏதாவது இருக்குன்னு சொல்லிட்டாங்கன்னா அப்படின்னு சொல்லிட்டு, and a lot of them do not want to know that there's something wrong, which I find very strange. But I think that is that's
see,
common.
but like I, you know, I can't entirely blame the other side too, because truthfully, I think, you know, because of whatever, right, media, few unscrupulous elements, whatever, general or bio, like, you know, and we always like to think positive, right? So which is why I actually tell people the one takeaway is please specialist kitta pogadinga. I mean, munna pinna theriyada doctor kitta poningna, there's a trust deficit, right? So you're dealing with that too. And believe it or not, I've actually had patients who have actually walked in not feeling right, and I don't know them, they don't know me, they've just walked into the hospital. So they're like, I mean, ECG shows like, okay, this is a heart attack, this is real, like the big deal. ஆனால் அவங்க வந்துட்டு என்னங்க நடந்து வந்தாங்க ஹார்ட் அட்டாக்னு சொல்கிறீங்கன்னு, சரி அரெஸ்டோட வந்தா ஐம் லைக் இட்ஸ் பட் யூ டோன்ட் நோ தேம். அண்ட் லைக் எனக்கு இனிஷியலி அது ரொம்ப ஸ்ட்ரேஞ்சாக இருந்தது. பட் தென் ஓவர் லைக் யூனோ ஓவர் த லாஸ்ட் செவரல் இயர்ஸ், ஸோ ஐ யூஷுவலி ஐ திங்க் இஸ் ஆமாங்க கரெக்டு. ஸோ ப்ளீஸ் நம்பர் ஒன், ஃபேமிலியில் ஏதாவது டாக்டர் இருந்தாங்கன்னா லிட்டரலி லைக் வாட்ஸ்அப் த இமேஜ் சே ஹே திஸ் இஸ் அ ஹார்ட் அட்டாக். யாராவது தெரிஞ்சவங்க இருந்தாங்கன்னா தட்ஸ் ஒன் திங் as doctors we can do. The other thing is that is exactly why you should have a primary doctor. Someone with whom you have a relationship, you have a trust. Then it's easy for you to, like, you know, we know we have some risk factors, periodic checkups. So I think it's super important that in the relationship, a person with their primary doctor romba mukkiyam.
So, what is the first aid one can actually do at home if someone we know in the family is having a heart attack? So, you said give them aspirin and statins if they happen to have it at home. Anything else? Because I'm going to ask you something really which sounds stupid, but there are WhatsApp forwards giving advice on coughing violently and banging your chest to keep your heart beating, and it was like it went viral and was forwarded very
So why do I miss all
widely.
this? Abdiya. No,
So
like this
is
is
that
real.
true or false? Yes, for real.
False.
Yeah,
Like, I think we
okay.
can have a segment later, but no, it's false.
Yes.
So please don't do such things. Take an aspirin, get to the hospital. The other thing that I would say that is super important, and I try to like actually get people to learn this. Every adult, and maybe even like from teenage, learn CPR. Because someone say has collapses because of a heart attack, ventricular tachycardia fibrillation, say they go into cardiac arrest. Learning how to do CPR can be life-saving. And until help arrives, you have to still, the heart has to still, you have to support the heart, pump blood. So idu panalena, like, it's a
Very
question of minutes. By 6 minutes, even if you get the heart back pumping, your brain is toast. So I think that's a life skill that every
Everyone
person should learn, and maybe have aspirin at home.
So, how is a heart attack different from a cardiac arrest?
We just kind of touched upon that. So heart attack is cessation of blood flow in the coronary vessels completa. This can lead to a cardiac arrest. Other things can also lead to a cardiac arrest. Cardiac arrest, basically what you're telling people, like what it means is that the heart is not pumping.
Stopped.
It's arrested. It's done, right? It's not working. This can happen due to a lot of conditions, but heart attacks are the most common reason. The other thing is like, I mean, I don't know how they came up with these terms. I think it's meant to be confusing, right? Heart attack, cardiac arrest, heart failure. So na fail ஆயிடுச்சுனா என்ன? So heart failure na basically that's more of a general, it's a acute இருக்கலாம், chronic இருக்கலாம். The heart is not pumping blood effectively. Arrest na full gali, like it's not just doing its work.
ஸோ அப்போ அந்த அரெஸ்ட் அப்படிங்கும் போது தான் you said that CPR is going to be
Correct.
life saving, right? Not any other. And CPR, I think you had last time for cardiac disease week. Or
Yeah, like
you
so
had
it
a
was
try
about a
to
year ago.
learn how to do CPR properly, right? So maybe we can pull up a demo and show that or something like that, because we don't have a mannequin or a ball here for you to really give a demo as such. And ஏன்னா முன்னாடிலாம் சிபிஆர் யூஸ் டு பி இந்த தமிழ் படத்துல எல்லாம் வந்து இப்படி பண்ணுவாங்க, தென் யூ ஹேவ் டு ப்ளோ இன் டு த மவுத் டு மவுத் ரெசிசிட்டேஷன் கொடுக்கணும் அந்த மாதிரின்ட்டு. நவ் இட்ஸ்
I
ஜஸ்ட்
mean, it's been like,
yeah.
I think, abused,
Yes.
whatever. There's a lot of, I think myths around CPR. But in essence, at least, as non-healthcare providers, people should at least learn hands-only CPR, right? I mean, you don't have to do mouth-to-mouth and all this stuff. And number two, don't watch movies to learn how to do CPR. Like, there's lots of myths around it. So
learn to do it properly, and that is one life-saving skill all of us can learn. So what are the risk factors for heart disease in order of importance?
So let's kind of categorize this into modifiable and non-modifiable, right? So non-modifiable எடுத்துக்கிட்டோம்னா நம்மளால என்ன பண்ண முடியாதோ, okay? So மாற்ற முடியாத விஷயங்கள், okay? Yeah, that's okay. Age, the older you are, the more likely you are to have heart disease. That's just the way it works. It's probably the single biggest risk factor. Genetics, to an extent, ரொம்ப ஸ்ட்ராங் ஜீன்ஸ். அதனால தான் லைக் when you go to a doctor, especially cardiac history கேட்கும்போது பேரண்ட்ஸ் பற்றி கேட்பாங்க, சிப்ளிங்ஸ் பற்றி கேட்பாங்க, அது இது. ஸோ இது ரெண்டும் ஜென்ரலாக I would say are strong non-modifiable ones. Now, மற்றது எடுத்துக்கிட்டிங்கன்னா you have all these lifestyle stuff. I mean, I would say the most common thing or the most important one I would say is, it's a toss-up, but I would say probably smoking. So if you're a smoker, please stop. Vaping is I would say pretty much equally bad, right? So vaping, smoking should be out the window. Diabetes, big one. So if you look at India prevalence and everything, I would say diabetes is huge. So take control of it. And for the most part, and I'm sure you've had this in other sessions, a lot of these are lifestyle diseases. And I think having good lifestyle will at least offset the age at which you get diabetes, hypertension, your cholesterol. So smoking, diabetes, hypertension, cholesterol, and மற்ற விஷயங்கள் இந்த லைஃப் ஸ்டைல் ஃபேக்டர்ஸ்லேயே வரும். நம்ம பாடி வெயிட்டு, எவ்வளோ ஆக்டிவாக இருக்கும், எப்படி சாப்பிட்றோம், and they're all kind of relatedனு வச்சுப்போமே.
So leading a healthy lifestyle, so that comes under the unhealthy lifestyle will be in the modifiable category.
Right.
So hypertension is said to be a silent killer. So why is that? What is normal BP actually? And what are the stages of hypertension?
No, excellent question. It's like the experts can't get it together, honest. And every time there's a new guideline that comes, we are actually waiting for the next set of guidelines. I think 2025, 26 la one varum. But general எடுத்துக்கிட்டிங்கன்னா, keep it as there is a top number and a bottom number. The classic is 120/80. There are stages, like you have, stage 1 hypertension, stage 2, I would say for the purposes of, this podcast, etc., the key is know your numbers, right? 120/80 is a good thing. மேல இருக்கிற number is systolic, கீழ இருக்கிற number is diastolic. The higher it is, the more and uncontrolled இருக்கும் பொழுது, you have a higher risk of renal failure, stroke, heart attack, and a plethora of other conditions. So if you do have it, you should start off with lifestyle. Most of them, that's the recommendation. Unless it's high enough that, sometimes, like I think the last set of guidelines basically say start almost with like 2 medications, because that's the average that you need to get it under control. But this is I would say you need to work with a doctor in managing this. And the thing is, it's called as the silent killer because you don't know your blood pressure. Yeah, I feel good. I mean, we don't know, but right now I'm 120, 80 or 130, whatever. We don't know that. You don't know your heart rate for the most part. I don't know at what rate I'm breathing. So a lot of these things. So I think, or your cholesterol, or your hemoglobin A1C, etc. So I think it's important to know this and work with your doctor.
ஸோ எனக்கு பிபிலாம் ஒன்றும் கிடையாது. இன்னைக்கு நான் கொஞ்சம் டென்ஷனாக இருக்கேன், தலை வலிக்குது, இல்லாட்டி வீட்டில் சண்டை போட்டுட்டு வந்தேன், அதனால தான் பிபி ஜாஸ்தியாக இருக்குது. இஸ் தட் ட்ரூ?
Yeah, blood pressure can fluctuate. And this is a question that even நம்ம patients கூட பார்த்தீங்கன்னா, டாக்டர் எனக்கு இது குறையுதா, ரொம்ப ஜாஸ்தியாக இருக்கா? Um, we are alive and our blood pressure is something that's dynamic. So yeah, it will go up and down, not just with activity, but even like நம்ம diurnal variation கூட இருக்கு. அதாவது காலையில் just before you wake up, it actually, once you, it kind of starts going up, and then once you're up, it actually does go up because you're getting ready for the day, you have a catecholamine surge where cortisol level starts going up, etc. So, and then during the day, but late night, it just drops when you're sleeping. So there is supposed to be a nocturnal dip. So there is supposed to be variation, number one. Number two, I think it's an important skill set. I mean, especially for doctors that are measuring blood pressure, that you train your nurses or you do it yourself. Learn how to measure blood pressure properly. ஸோ ஒருத்தங்க நிஜமாவே கரெக்டு அர்ஜென்ட்டாக இப்போ அப்பாயின்மெண்ட்டுக்கு நம்ம லேட்டாக வந்திருக்கோம், வந்தோடனே உட்காந்தோடனே வாங்க டாக்டர் வந்துடுவாங்க, அதுக்குள்ளே நம்ம செக் பண்ணோன்னீங்கன்னா ப்ரெஷர் கேன் பி ஹை. ஸோ என்ஷூர் தட் தே ஆர் தே சிட் எப்படி உட்காடுறோங்கிறது முக்கியம், எவ்வளோ நேரம் குவாய்ட்டாக இருக்கோங்கிறது முக்கியம்.
ஸோ ஒயிட் கோட் ஹைப்பர் டென்ஷன் எனக்கு வீட்டில் பார்க்கும்போதெல்லாம் நார்மலாக இருக்கும், டாக்டர் கிட்ட வரும்போது மட்டும்தான் ஹையாக இருக்குது. ஸோ அது டென்ஷனாக இருக்கேன்னு நினைக்கிறேன், வேறு எதுவுமே கிடையாது, எனக்கு பிபிலாம் கிடையாதுன்னு சொல்லிட்டு வி வுட் கம் அக்ராஸ் திஸ் சினாரியோ pretty often.
Right, exactly. As you said, that the phenomenon has a name, white coat hypertension, because you're seeing the doctor makes people stressed.
So we don't wear white coats nowadays.
ஆமாம், நம்மளை பார்த்து எதுக்குங்க ஸ்ட்ரெஸ் ஆகிறீங்க? ஸோ but it's a real phenomenon, right? Something is being measured, the very act of measuring it can change it. The unfortunate thing is that even that can correlate with bad outcomes. In fact, the other thing that I often do is and it's very underutilized in my Indian medical system. It's an ambulatory blood pressure monitor. So 24 hours, okay, go get it measured. Day எப்படி இருக்கு, நைட்டில் எப்படி இருக்கு, overall எப்படி இருக்கு. Because remember, we're just taking data points at certain snapshots மாதிரி எடுத்துகிட்டு இருக்கோம். And then we are trying to come up with meaningful results, and it's an artificial environment. So that is something that's super helpful. But unfortunately, the reality is that when you do have white coat hypertension, it does correlate with bad outcomes. So
you may have hypertension.
You may
so
have.
do not just disregard it and probably get your BP checked at a later time. So ஒரு வாட்டி BP check பண்றோம் in the clinic, so it was raised and they do not have history of hypertension. So what do we do? How often do we ask them to check before we say probably you have a problem?
So great question. Depends. So unfortunately, I can't give you a straight answer to this. It depends on how high it is. See, hypertension,
borderline 130, 90.
I would say, the first thing, honestly, is you look at their overall profile, right? I mean, if it's a young 20-year-old who just has one, there could be reasons for that too, but I'm just saying, irukana, go recheck it at a later point. Obviously, you need to know if it has been measured properly. I would say the first thing is make sure they're comfortable, this. Have the doctor perhaps check if it's persistently elevated. Again, the usual is lifestyle changes first. Let us say cut salt and take a little bit, lose some weight. Oftentimes it's because they are a little bit on the heavier side. Eat right, and then lifestyle modifications, see how things are. And if you're still not at target, and depending on your other risk factors, you may consult your doctor and choose to treat it with medications.
Role of genetics or family history of heart disease. So that's a non-modifiable risk factor. So how important is it, and how often do you come across it in the Indian scenario?
Now this is, so yeah, I did put it under the non-modifiable risk group, Anna. See, it's I'm sure our audience may be aware of this. Epigenetics is an entire field, right? What kind of genes do get expressed, what don't, a lot of time is determined by our lifestyle. Now, yeah, there are some people, unfortunately, that have a very, very strong family history. and despite their best effort, things they might still be destined for heart disease. And a lot of us overall எடுத்துக்கிட்டிங்கன்னா South Asiansக்கு நமக்கு Indiansக்கு we have almost over a decade முன்னாடி we get heart disease. And that is because there is a strong genetic thing. And plus, we are not helping ourselves, right? All the modifiable ones, the lifestyle stuff, and maybe things have changed at least, but when we grew up, there was not much emphasis on, sports. It's like, padichada nalla pulla, right? Like, that kind
I
of
think
stuff.
it's quite there.
Yeah, it's like, and I think those early habits, unfortunately, we have to get over, right? We tend to be sedentary. We've gotten bad in a sense with comfort foods and, like all these fast food stuff that you get. It's become even more convenient and easy for us to access. And yeah, the cool vaping, smoking stuff, has probably become a bit more prevalent even amongst women. So we're not helping our genetic causes. I mean, our genetic predisposition. So good lifestyle can actually offset to an extent, even if you do have bad genes. And of course, if you do have a very strong family history, take ownership of it. It is what it is. Like, your parents gave you a lot of
You
things.
can't change it.
And then, but what you can change is orvala cholesterol irundhuduna, being on appropriate therapy for it, lifestyle, and taking ownership of it. The hypertension, diabetes, cholesterol trio needs to be managed really aggressively.
ஸோ எங்கள் அப்பாவுக்கு இருக்குது பிபி, எங்கள் அம்மாவுக்கு இருக்குது, எங்கள் வீட்டில் எல்லாருமே வெயிட்டாக தான் இருப்போம், இந்த மாதிரியே சொல்லிட்டு அலையாமல். ஸோ ஜெனட்டிக்ஸ் load the gun, but lifestyle pulls the trigger. So the trigger is like whether you pull it or not is in your hands and சொல்லலாம்னு நினைக்கிறேன். So we come across this particular thing quite often. எல்லாரும் சிகரெட் பிடிக்கிறாங்க, தண்ணி அடிக்கிறாங்க, அவங்களுக்குலாம் ஹார்ட் அட்டாக்கே வரது கிடையாது. எதுவுமே பண்ணலை, டீடோட்டலர், பிளேஸ் வெல், இஸ் லீன் ஆர் வாட் எவர், அண்ட் எந்த பேட் ஹேபிட்ஸும் கிடையாது, அவங்களுக்கு தான் ஹார்ட் அட்டாக் வருதுன்னு. திஸ் இஸ் அ சினாரியோ விச் இஸ் ஆஃபன் ரிப்பீட்டட்னு. அப்போது அவங்களுக்கே வருது, இன்னும் வேறு என்ன, நான் நல்லா தானே இருக்கேன், எதுக்கு என்னை மாற்ற சொல்கிற அப்படின்னு சொல்லிட்டுன்னு. ஸோ வாட் வுட் யூ சே வித் ரிகார்ட் டு திஸ்?
I mean, see, the unfortunate thing is, now with social media and everything, right? Something rare is what catches attention. There's a smoker who is like, obese, 65 வயசு, which is much more statistically likely, they are much more statistically likely to have heart disease. Getting a heart attack doesn't make news. A 28-year-old, let's throw in something else, okay? A celebrity who is relatively fit, getting a heart attack in their 30s, 40s, whatever, makes news. So, and that's partly, the way news is reported. Like, common things don't get reported. Uncommon things do. And so that's something that I think our intelligent viewers will definitely understand. So that's one thing. The second thing is, like, see, just because you do all the things right does not mean you won't get a heart attack. It just reduces the chance of you getting a heart attack. Now, it's like, நான் லிட்டரலி தான் சொல்லுவேன், நீங்கள் கண்ணை மூட்டு ஒரு வாட்டி நீங்கள் ரோடை க்ராஸ் பண்ணிட்டீங்க, சரி, கிரேட், குட் ஃபார் யூ. ஸோ அதுக்குன்னு திருப்பி நம்ம க்ராஸ் பண்ணிட்டு இருக்க மாட்டோம். ஆர் லைக், டேக் another example. Driving, you can drive carefully, you can be an expert driver, you can have a good car, நீங்கள் ஸ்பீட் லிமிட்டில் போகலாம், but you can still have an accident. Now, take the other thing. Hey, நான் sometimes text பண்ணிட்டு ஓட்டுவேன், இல்லை குடிச்சிட்டு ஓட்டுவேன். I'm like, okay, it's illegal. But the point is, இந்த மாதிரிலாம் பண்ணிங்கன்னா கூட நீங்கள் sometimes accident இல்லாமல் இருக்கலாம். But you're increasing the likelihood of having an accident. So, goes back to your life is sort of in your hands. So make wise decisions.
And even on a personal note, I was telling, because Ashok doesn't have any habits as such. He plays sports every day. And then he was the one who landed up with the heart attack. And so even among the friends, after he got over the acute phase and everything was okay, he didn't have any... because the collaterals were really well developed for him, maybe because of his sports. He didn't have any muscle damage, so nothing was there. So எல்லாரும் சொல்லும்போது அதுதான் நான் சொல்வேன் ஒரே வார்த்தை, because the other friends of ours who smoke and drink and then used to say that we are not the ones who got the heart attack. I said, அவனுக்கு வந்தது, அவன் பழைச்சிட்டான், எந்த டேமேஜும் இல்லாமல். உனக்கு வந்ததுன்னா நீ பழைப்பியான்னு எனக்கு தெரியாது, கேர்ஃபுல்லாக இருந்துக்கோன்னு சொல்லிட்டேன்னு. ஸோ அஃப்கோர்ஸ் all these habits will have some benefits, Either even if he got the heart attack, how he gets over it and stuff like that. And then maybe the severity maybe increase when your risk factors are also more, I would say.
So, just to emphasize what you said, the number one patient group, nama pathiktomna, especially in younger people that get heart attacks, are smokers. You can almost bet statistically ஒரு 40 வயசு கீழே ஒரு ஆள் ஹார்ட் அட்டாக் கூட வந்தாங்கன்னா most of them are smokers. So that's the one modifiable thing that you can do, right? If you're smoking, please quit smoking.
So you touched upon this that news media we see youngsters and celebrities dropping dead when they were exercising, and then CEO of a company and he landed up with heart attack at 40 years and stuff. So why are many youngsters getting heart attacks nowadays, and do you think this is only going to increase in future? So I would say I'm scared for the future generation.
I would hope not, honestly, sincerely, right? Because this is something that I think is really preventable. And so when it comes to why youngsters are getting more heart disease, I think we again kind of danced around this, but just to be explicit, first thing is people are not very self-aware, and we have this perceived thing like I feel good, I don't have any problems, so I don't want to go around looking for it. My humble request is take ownership. Say after 20, make sure you don't have like genetically you have high cholesterol, it can hurt you. We talked about hypertension, the silent killer. So you don't know your blood pressure unless you check it. You don't know if you have diabetes unless you get a blood test. You can't feel it. I mean, yes, you can have symptoms, but that's usually too late. So take ownership of your health. That's one thing. And the other reason I think big time is all the lifestyle stuff that we talked about, right? More sedentary work. The stress has become rumbave a big thing. Sleep has gone for a toss for the most part, thanks to COVID, this, that.
Thanks to Netflix.
And so I don't want to blame any.
Yeah.
I mean, we make decisions. So, yeah, we can choose and watch documentaries at a good time too, right? Anyways, but yeah, jokes aside, I think lifestyle, tukam, stress, food, lack of exercise or over-exercise. And we can, maybe at a later time, we can kind of talk about that too a little bit. So, idalam kuda karanam. And of course, like you didn't even ask me, but the everyone wants to blame something for increased heart attacks. And it's like, must be the damn COVID vaccine, right? So, look, it is what it is. And I think it is such a, hopefully once in a lifetime kind of an event. And COVID
and now
itself,
again it's coming.
yeah, like the resurgence. COVID itself was, I think, we have pretty good data. It was kind of an inflammatory thing. So, nariya inflammation trigger achu. So, whether it was the virus itself, and almost I think everyone or someone very close to them got COVID. And again, the vaccine, yeah, I mean, it is what it is. We had to be vaccinated to protect ourselves. And whether it increased statistically a little bit, possible, I don't want to say anything about it. But the point is, it is what it is. And moving forward, we work on the modifiable stuff. And that has a significant impact. And if you think about it, even the mortality from COVID was, a lot of the people had underlying comorbid conditions. Yes, you did find the occasional healthy person that when, unfortunately died, but many of them had underlying disease that was undiagnosed.
Taking ownership, doing tests. Is there anything exactly we can do to check our heart health at home?
Yeah, at home. I mean, I would say do
heart
a
rate, pulse rate account pani paakalaama.
see like the issue with some of the quote unquote at home stuff is, and I'm worried about making suggestions here, is because it can lull you into a false sense of security, right? Like அவங்க சொன்னாங்க அந்த பாட்காஸ்ட்டில் இது பண்ணால் நம்ம ஹார்ட் நல்லா இருக்குதுன்னு அப்படின்னு அந்த காலத்தில் நீங்கள் உங்களுக்கு by the way I have to ask you this, ப்ரெக்னென்ட்டான்னு சொல்லிட்டு பல்ஸ் பார்த்து சொல்ல முடியாதுல்ல? முடியாது தானே? Okay. So அது மாதிரி it's really hard to have one at home test. But overall, I would say a good measure would be உங்கள் நார்மல் ஆக்டிவிட்டீஸ் பண்ணும்பொழுது many times we attribute certain things to I'm getting old. வயசானா இதெல்லாம் சகஜம் தானே இல்லைங்க. Oh yeah, the other thing too, right? my dad was like, he's very active. எப்படி அவர் ரொம்ப active அவருக்கு. See, many people think going to work, doing your ADLs, right, the activities of daily living, constitutes being healthy. They are two different things. That means you're doing like, evlo medicine, I mean, we can talk about that too, right?
Basic minimum.
Yeah, basically 0 to 3 is like, I mean, you're just literally just existing. Let's say mild exercise. இது பண்ணிட்டு ஸோ காரில் போயிட்டு நம்ம ஒரு இடத்துல உட்காந்து வேலை பார்த்துட்டு இல்லை ஒரு ரெஸ்டாரண்ட்டில் போய் சாப்பிட்டுட்டு திருப்பி வர்றது இது எஸ் யூ ஆர் ஆக்டிவ் பட் யூ நாட் ரியலி ஆக்டிவ். ஸோ இன்கேஸ் யூ ஹவ் டிஃபிகல்ட்டி, முன்னாடி நான் வந்து 2 மாடி ஏறிடுவேன், இப்போ வந்து இல்லைப்பா லிஃப்ட் எடுத்தால் பெட்டராக இருக்குது, இந்த மாதிரி திங்ஸ்க்கு பே அட்டென்ஷன் டு இட் பிகாஸ் திஸ் குட் represent not just aging, it can be because of age, but many times if there is a rapid deterioration, you're not able to do these things. Just do a bit deep dive, be a bit more self-aware. ஏன் நான் நடந்தால் மூச்சு வாங்குதா, அதான் காரணமா அப்படிங்கிறது அது நமக்கு நம்மளே ஆனஸ்டாக இருந்தால் தான் you can actually go seek help. So I would say this is the one at-home test.
So what are the basic tests we should do? So there's nothing really which we can check ourselves at home, Solliache. So what are the basic tests you think one should do to check their heart health, and at what age? Or say in their 20s, 30s, 40s, would you split it like that?
In your 20s, definitely I think you should know if you have high blood pressure, cholesterol and diabetes irka. Koranjapaksha in the moon tereno. And yeah, in your 30s, I would say probably the same. And say 40s and above, it kind of depends on your risk factors. I mean, even family history எடுத்துக்கிட்டிங்கன்னா கூட அது ரொம்பவே முக்கியமான விஷயம். We've already talked about it. So sometimes even in your 20s, there may be some advanced blood tests such as your ApoB levels and LP small a and a few other things like you can check HSCRP. There are few things that can be checked. But again, talk to your doctor. உங்கள் ரிஸ்க் ஃபேக்டர்ஸ் பொறுத்து, உங்கள் ஃபேமிலி ஹிஸ்ட்ரி பொறுத்து அதை பார்க்கணும். ஸோ another thing that can be considered is CT CAG. அதாவது சிடியில் நம்ம blood vessels எப்படி இருக்குது அப்படிங்கிறத பார்க்குறது.
I'm curious about cholesterol. There's a lot of like myths and misconceptions about it. Cholesterolங்கிறதே ஒன்று இல்லை, cholesterol தான் வந்து cause for everything and all other scenarios in between the two extremes. So I am sure from a cardiologist point of view, you would agree that cholesterol is very important risk factor for heart disease. So lipid profile la nariya varudhu illaya. So when you break down the lipid profile report for us, the good, bad and ugly of parts of a cholesterol report.
Simple எடுத்துக்கலாம்னா few things பாருங்க. So cholesterol does matter. At least the bulk of evidence would point towards cholesterol being an independent risk factor for heart disease. Now, there is what we call good cholesterol and bad cholesterol. So we'll keep it simple, right? HDL irukku. So idu vandu good cholesterol. Non-HDL ellame basically bad cholesterol. Adila specific nama LDL, low density lipoprotein. Idu vandu it's kind of implicated in heart disease quite a bit. Adila nariya subdivisions alla irukku. Anga da nama what we talked about, like sometimes you might want to check lipoprotein A, ApoB, அதெல்லாம் பார்க்க. There are other blood tests that can be done. This? So yeah, I mean, நீங்கள் நார்மலாக டெஸ்ட் பண்ணும்போது blood testல வராது, but it needs to be specifically ordered. So generally, yes, to answer, there's a good cholesterol component. HDL, the higher it is, the better it is. The non-HDL, the higher it is, the worse it is. So we'll keep it simple.
Total cholesterol, is it important?
Yeah, but it depends on the ratio, right? So if your total cholesterol is, and remember your LDL, depending on lab value, it's a calculated thing. So, நீங்கள் HDL வச்சுட்டு அது ஒரு ஃபார்முலா இருக்குது, அதை வச்சு தான் நம்ம நிறைய திங்ஸ் கால்குலேட் பண்ணி வரும். ஸோ சில நேரங்களில் ஃபார் எக்ஸாம்பிள் நம்ம ட்ரைக்ளிசரைட்ஸ் ரொம்ப ஜாஸ்தியாக இருக்கும்போது LDL ஆர்டிஃபிஷியலி லோவாக இருக்கலாம். பட் அகேன் இந்த இன்டர்பிரிட்டேஷன் டாக்டரோட வச்சு பார்த்துட்டு ஓகே நிஜமாக ஜாஸ்தியாக இருக்கா, என்ன கம்போனன்ட் ஜாஸ்தியாக இருக்குது, எப்படி வந்திருக்குன்னு, ஏன்னா அதுக்கு கூட டைரக்ட் LDL அப்படிங்கிறத நம்ம மெஷர் பண்ணலாம்.
Okay, so what do you want the LDL levels at or below being a cardiologist who treats heart disease?
So again, I'm biased, right? See, I see a lot of patients with heart disease. In fact, I see almost all patients with heart disease. So எங்களுக்கு lower is better. So 50 LDL nu vachupom as a target. 50 and lower is ideal because that prevents நியூ பிளாக் ஃபார்மேஷன் எசென்ஷியலி எடுத்துக்கிட்டிங்கன்னா நான் ஒன்று எல்லாரும் அதுக்கு ஷூட் பண்ணுமாங்கிறது அவசியமாக இல்லை. ஏன்னா அதுக்கு பண்ணுறதுக்கு வி புட் தம் ஆன் மெடிகேஷன், சம்டைம்ஸ் இன்ஜெக்டபிள்ஸ், திஸ் தட். ஸோ less than 70 is good. And again, it depends on your other risk factors. So the isolation எடுக்கிறது கடினம். But general எடுத்துக்கிட்டிங்கன்னா ஒரு LDL 100க்கு கீழே இருந்தால் you can kind of be okay for the general public.
ஸோ இசிஜி நான் போய் பார்த்தேன், எனக்கு லேசாக நெஞ்சு கரிச்சுது. இப்போ இசிஜி பார்த்தேன், நார்மலாக தான் இருக்குது. ஸோ அப்பப்போ போய் பார்த்துக்கிறது. அசோக் என்னையே சொல்லுவான், சும்மா வந்து சம்டைம்ஸ் ஐ ஹேவ் சம் ஹார்ட் பர்ன்னா கூட போய் இசிஜி சும்மா போய் இசிஜி மட்டும் எடுத்து ஒன்றும் யூஸே கிடையாது. ஸோ வாட் இஸ் அன் இசிஜி, வாட் இஸ் இட் ஆக்சுவலி டெல் அஸ்?
An ECG is an electrocardiogram. So it measures the electrical activity of the heart. So again, நம்ம முன்னாடி பேசியிருந்தோம்ல, the plumbing can affect the electrical stuff. ஸோ பிளாக்கேஜ் சம்டைம்ஸ் இருக்கும்போது அந்த பகுதியில் ரத்தம் போகலைன்னா சில நேரத்தில் ECGயில் மாற்றங்கள் இருக்கலாம். அமாங்ஸ்ட் மெனி திங்ஸ் தட் யூ கேன் பிக் அப் ஆன் அன் ECG, there is one thing that you can. பட் லைக் எனி டெஸ்ட் அதுக்கு ஒரு சென்சிட்டிவிட்டி இருக்குது, ஸ்பெசிஃபிசிட்டி இருக்குது. அதாவது சில நேரத்தில் பிரச்சனை இருந்ததுன்னா காமிக்கும், சில நேரத்தில் காமிக்காது. அது மாதிரி சம்டைம்ஸ் பிரச்சனை இல்லாமல் there can be some variation or not. So in general, it's a first line test. ஒருத்தங்க நெஞ்சு வலியோட ஹாஸ்பிட்டலுக்குள்ளே போனாங்கன்னா the first thing that people do is a ECG, because அதுக்கு ஒரு கிளாஸிஃபிகேஷன் இருக்குது. ஹார்ட் அட்டாக்ஸில் நிறைய ரகங்கள் இருக்குது. ஸோ அதுக்கு ECG is an important criteria. பட் ஒருத்தங்களுக்கு கம்ப்ளீட்லி நார்மல் ECG இருந்தால் there is no need to, like, I mean, especially if you have no symptoms, 3 மாதத்துக்கு ஒரு போய் செக் பண்ணிட்டு இருக்கணுங்கிறது அவசியமாக இல்லை.
So only if you have a chest pain and you
When
need to go, or you're doing it as part of an annual check.
I think it's good to have a baseline, and it depends on the symptom.
The other commonly performed test, echo. So what does it actually tell us about your heart?
Echocardiogram is just like what you guys do, is an ultrasound, except it's of the heart, not the the pelvic organs, I guess. So it tells you how the heart is pumping. It tells you like on the wall thickness எப்படி இருக்கு, relaxation எப்படி இருக்கு ஹார்ட்டுக்கு. ஏன்னா there is a systolic component, there's a diastolic component. ஹார்ட் ரிலாக்ஸ் ஆகணும். வால்வ்ஸ் எப்படி இருக்கு, இந்த மாதிரி நிறைய விஷயங்கள் எக்கோவில் பார்க்கலாம். அதே மாதிரி சம்டைம்ஸ் people have had a heart attackனு வச்சுப்போமே, அதோட எஃபெக்ட் தெரியலாம். Sometimes with chest pain, but again, I don't want to get into too much of details, but essentially it's a ultrasound of the heart, which tells you how the heart muscle is pumping and how the valves
effectively
are,
it is pumping. அவ்வளவுதான். So இப்போ ECG எடுத்தாங்க, எக்கோ எடுத்தாங்க,
right,
went to sleep, didn't get up the next morning. அது நான் என் ஃபேமிலியிலே பார்த்துருக்கேன். within 2 days of having a normal ECG and echo, passed away in a sleep due to a massive cardiac arrest. And my uncle, he was only, I think he was in his mid-40s when he went. So again, இந்த மாதிரியும் நம்ம பார்க்குறோம். ஸோ ஜஸ்ட் ஹேவிங் தோஸ் 2 tests done, that doesn't really signify that everything's perfectly okay.
So that's entirely true and not inconsistent. ஏன்னா it just tells you the state of affairs at that time, right? அந்த டைமில் heart muscle is pumping well. So 2 days later, I mean, அவங்க blood vessel supply to the heart எப்படி இருக்குங்கிறது your echo doesn't tell you, right? So it's possible that they can have a heart attack 2 days later. So முக்கியமான விஷயம் என்னன்னா, so at least for our viewers, just because 2 days ago you had a normal echo and then you have chest pain, let's say it's like textbook, நெஞ்சு அழுத்தம் இருக்கு, நேத்தான் எக்கோ பார்த்தேன், நார்மலாக தான் இருந்துச்சு, அதுக்குள்ளே எப்படி பிரச்சனை வரும், நல்லா தானே இருந்தேன் அப்படின்னு சொல்லிட்டு don't ignore the symptoms. So that's I think the important message.
Exactly. So when in obstetrics, what I tell the patient is, scan ipa paatho, ipo baby nalla irukku in the second, that's all I'll be able to tell you, not how it is at home. So just because there's a normal scan report, that doesn't mean something can't occur the next day or even an hour later. So something like that, I would say.
And on top of that, an echo does not look at your blood vessel supply to the heart. So it's not even designed for that.
So what is designed for that? So to check whether blood supply to the heart is going well, what are the tests which are done?
Lots, right? So the most basic test is a treadmill test, TMT in சொல்லுவோம். So that basically looks at the ECG, but there is a structured protocol. So நம்ம ரெஸ்ட்டில் இருக்கும்போது resting ECG, ரைட்டுங்களா? ஸோ நடக்கும் பொழுது, and there's a 3 நிமிஷம் ஃப்ளாட்டாக இருக்கும், அப்படி கொஞ்சம் கொஞ்சமாக. ஸோ it makes the heart work harder through a structured protocol. In the protocol போது நம்ம இசிஜியில் மாற்றங்கள் இருக்கா அப்படிங்கிற பார்க்குறது தான் ட்ரெட்மில் டெஸ்ட். அகேன் இது வந்துட்டு ஒரு அதில் வேரியஸ் ப்ரோட்டோகால்ஸ் இருக்குது
சரி,
சரிங்களா.
ஃபாஸ்ட்டாக நடக்க சொல்கிறீங்க, சில பேரால் நடக்க முடியாது, அந்த மாதிரிலாம்
அவங்களுக்கு பண்ண முடியாது.
பண்ண முடியாது.
இட்ஸ் ஒன்லி த செயின் இஸ் ஒன்லி ஆஸ் ஸ்ட்ராங் அஸ் த வீக்கஸ்ட் லிங்க். எனக்கு அதான் நான் சொன்னேன், எனக்கு மூட்டு வலி இருக்குது, என்னால் நடக்க முடியாதுன்னா அவங்களுக்கு போய்ட்டு நான் ட்ரெட்மில்ல போட மாட்டேன். நம்ம இது டசன்ட் மேக் சென்ஸ், ரைட்? பட் மெனி டைம்ஸ் it's a like many things in medicine, it's a good test as long as people do it, use it wisely. It can tell you a lot about how functional the person is. People are like, எனக்கு சிம்டம்ஸே இல்லைங்க, நான் ஜாலியாக இருப்பேன். ஆனால் அவர் எப்போவுமே எலிவேட்டர் தான் எடுத்துகிட்டு போவார். சரிங்க, நீங்கள் நடந்தானே வந்தீங்க, சும்மா மெதுவாக நடந்து பாருங்க. there's a protocol that you can do for the old people protocol, the modified Bruce. ஸோ நீங்கள் அதில் போட்டிங்கன்னா நடந்து காட்டுங்க. ஒரு வேணால் கொஞ்சம் தூரம் லைக் இன்னும் அவங்க வார்ம் அப் ஃபேஸ் முடிஞ்சுட்டு ஃபஸ்ட்டு ஸ்டேஜ் போகும்போதே எனக்கு மூச்சு கொஞ்சம் வாங்குறாப்புல இருக்குன்னு, போதும் தான் நடக்கிறேன் இல்லைங்க அப்படின்னு. ஸோ அவங்க ஏஜுக்கு ஏற்றாப்புல if it can be a 55-year-old person that should be able to do more. பட் அவங்களால பண்ண முடியலன்னா அதுக்கு ஒரு காரணம் இருக்கலாம். And the ECG improves the ability of that test to not just look at the functional symptoms and all this stuff, but also ability to pick up disease. Now, is it foolproof? No. But I think it's a very inexpensive, cheap test. I'm sure people know there's a nuclear stress test. There is you can do a stress MRI. You can do a stress echocardiogram. Lots of non-invasive tests that can also help you. Then, of course, the blood supply actually பார்க்கணும்னா the anatomical tests are CT, CAG, and the gold standard is still a coronary angiogram.
Okay. So CT, CAG, who would you advise it for?
Okay, so this, again, honestly, there are many ways to kind of do this. In fact, I think maybe about a year ago, there was a very interesting article and a rebuttal. So one of ரொம்ப ஒரு eminent or star cardiologist in our country talked about how sudden heart attacks will just be a thing of the past if everyone gets a CT CAG at 40. And then there was a very strong rebuttal saying there's no data for this. என்ன ப்ராப்ளம்னா, it is a data free zone. So இது ரைட்டாக தப்பான கிளியராக சொல்ல முடியாது. But see, like most things in life, there is no right answer. If you have a very strong family history, மற்ற விஷயங்கள் இருக்குது, ஒரு ட்ரெட்மில் வந்துட்டு பாசிட்டிவாக வந்திருக்கு, ஆனால் எனக்கு ஆன்ஜியோகிராம் பண்ணுற விருப்பம் இல்லைன்னா, yeah, you can do it. Sometimes ரொம்ப strong family history இருக்குது, I just need to know, can it help change my lifestyle? See, some people are like, no, I don't have disease, I don't want to know this. And some people are like, okay, I'm willing to accept a normal risk. Some people are like, no, I want to know.
What is
if you
my
want to
specific
know,
risk?
then you have to do either a CT CAG or a coronary angiogram. The thing with CT CAG, again,
So CT, CAG is just like your CT scan.
except for you're looking at the blood vessel supply to the heart. Now, there's an important caveat here, and I think it's important for our audience to know. It's got really good negative predictive value. Sorry, scientific but the important thing is, normala vandicha, you're off the hook. Now, let us say, and the reason I say this is sometimes people, because they have access to stuff, and because they hear people saying this, oh, I don't need an angiogram, let me just get a CT CAG. It's really hard to, for example, quantify certain things. ஒரு ஏற்கனவே உங்களுக்கு ஸ்டென்ட் இருக்கும், பைபாஸ் கிராஃப்ட் இருக்கும், உள்ள ஃபுல்லாக கால்சியம் இருக்கும். எங்கள் சிடியில் வந்து இப்போ 70% தான் சொன்னாங்க, ஒரு 60% சொன்னாங்க. ஸோ ப்ளீஸ் டாக் டு யுவர் டாக்டர் before you make a decision to do these tests. ஏன்னா this comes with radiation, there is contrast. So இதெல்லாம் talk to your doctor, maybe even your cardiologist and do it. சும்மா I just feel like doing it அப்படின்னு போய் பண்ணாதீங்க.
So then you will be like stuck not knowing, and then
exactly
confuses
ஏன்னா அதுக்கப்புறம் இதில் blockage வந்திருக்கு, then I'm like, okay, do I take him for an angiogram? It's like you're opening Pandora's box, so just be careful.
So தேவைன்னா பண்ணிக்கிட்டா போதும்னு.
And டாக்டர் கூட பேசிட்டு தேவையான முடிவு பண்ணுங்க.
And CT angiogram is that, and then what is your coronary angiogram is?
So a coronary angiogram essentially is where we inject contrast into directா. இப்போ CT CAG-ல வந்துட்டு நம்ம கான்ட்ராஸ்ட் வெயின் வழியாக கொடுத்து டைம் பண்ணி எடுக்கிறாங்க. ஸோ ஃபாஸ்ட்டாக அந்த சிடி பண்ணிவிட்டு வரும். கொரோனரி ஆன்ஜியோகிராம்ங்கிறது அதே எக்ஸ்ரே மிஷின் தான் அது. பேசிக்லி இட்ஸ் அ ஃபேன்சி எக்ஸ்ரே மிஷின். அண்ட் யூஆர் கோயிங் டேரெக்டாக ஒரு கேத்தடர் எடுத்துகிட்டு ஸ்ட்ரெயிட்டாக நீங்கள் சொன்னீங்க இல்லையா, ஸோ ஃபர்ஸ்ட் பிளட் சப்ளை அவுட் ஆஃப் த ஹார்ட், இந்த அயோட்டாங்கிற பெரிய குழாயிலேருந்து த சப்ளை டு த ஹார்ட் இட் செல்ஃப், அதை கேன்யூலேட் பண்ணி, அதாவது அந்த ஓப்பனிங்கில் நம்ம அந்த ஒரு டியூப் வச்சு கான்ட்ராஸ்ட் இன்ஜெக்ட் பண்ணி நேராக அந்த குழாயை பார்க்கறது. I mean, நேராக through with X-ray. You're directly taking pictures and you'll take multiple projections so that you get a good 3-dimensional reconstruction in your head.
So basic coronary angiogram na என்னன்னு சொல்லிட்டு you told us that we are just looking at the blood supply to the heart. So what is an angioplasty? What's the difference?
So angioplasty na basically the medical term is balloon angioplasty. சரிங்களா? ஸோ ஒரு வயர் வச்சு அந்த பிளாக்கேஜை தாண்டிட்ட பிறகு ஒரு பலூன் வச்சு இன்ஃப்ளேட் பண்ணி அந்த பிளாக்கேஜ் இருக்கிறத திறக்கிறது. மெனி டைம்ஸ் பலூன் ஆன்ஜியோபிளாஸ்டிக்கு பிறகு வி புட் இன் அ ஸ்டென்ட். ஸ்டென்ட்டுங்கிறது இட்ஸ் அ மெஷ். ஸோ அந்த வெசல் திருப்பி மூடிடக்கூடாதுன்னு சொல்லிட்டு ஒரு ஸ்டென்ட் வைக்கிறாங்க. ஸோ இது ரெண்டுமே இட் கம்ஸ் அண்டர் த மெடிக்கல் டேர்ம் இஸ் PCI, பெர்க்யூட்டேனியஸ் கொரோனரி இன்டர்வென்ஷன். சம்டைம்ஸ் இது பண்ணும் பொழுது உள்ள கால்சியம் இருக்குது, மற்ற விஷயங்கள் இருந்ததுன்னா வி மைட் டூ அதர் டெக்னிக்ஸ் லைக் லேசர் அத்ரெக்டமி, ரோட்டாபிளேஷன், ஆர்பிட்டல், இந்த மாதிரி சில டெக்னிக்ஸ் இருக்குது. இது பண்ணுறதுக்கு காரணம் என்னென்னா நம்ம ஸ்டென்ட் வைக்கும் பொழுது அந்த வெசல் நல்லா திறக்கணும், அதுதான் மேட்டர். ஸோ அதுக்கு சம்டைம்ஸ் வி டூ ஆல் தீஸ் ப்ரிப்பரேட்டரி திங்ஸ். சில நேரங்களில் பலூன் ஆன்ஜியோபிளாஸ்டி மட்டும் பண்ணிவிட்டு ஒரு ட்ரக் கோட்டட் பலூன் மட்டும் பண்ணிவிட்டு வி கம் அவுட். But again, it depends on the vessel, size of the lot of things.
So what exactly is a stent? I think you told us it's like a wire mesh which is put there to keep the vessel patent அப்படின்ட்டுன்னு திரும்ப கொலாப்ஸ் ஆகாமல் ஒரு பிளாக் ஆகாமல் இருக்கிறதுக்கு ஹெல்ப் பண்ணுன்ட்டுன்னு. அதுக்கு do the patients ask you if you give lifelong guarantee, warranty அந்த மாதிரி எதாவது கேட்பாங்களா?
So see, there is no guarantee in life, but what we can do is there are again the multiple things that go into that factor. In fact, the big myth is bypass na lifetime guarantee, stent na எவ்வளோ நாளுங்க தாங்கும் அப்படின்னு. லிட்ரலி நம்ம டயர் மாதிரி 5,000 கிலோமீட்டரில் மாற்றணுமா அந்த மாதிரி ஒரு, பிகாஸ் ஐ திங்க் ஒரு காலத்தில் ஸ்டென்ஸ் ஃபெயில்டு a fair bit. But like I mean, the truth of the matter is that anything can fail. So about a quarter of my patients are post bypass, graft மூடிரும், அதுக்கப்புறம் வேறு என்ன பண்ணுறது அப்படின்னு சொல்லிட்டு. So what I can tell you is in today's day and age, the probability of stents failing, if done right, so operator variables எல்லாம் நம்ம ஒழுங்காக பார்த்தோம்னா is actually really low. Now, of course, நம்ம இதெல்லாம் பண்ணிட்ட பிறகு நான் போயிட்டு அப்பா இதெல்லாம் பண்ணியாச்சுடா இனிமேல் தம் அடிக்கலாம், I want to eat what I want அப்படின்னு பார்த்தோம்னா it can. And there are certain genetic factors that can. So I would say it's like less than a 5% rate if patients do their part and the doctor does their part.
So as you rightly said, I know people who have had stenting, they've had bypass and then they still continue to smoke, which really surprises me that they are so cavalier about their health and about their lives, because it's not as if they can be saved each time, Ilya.
True. And I think, honestly, the other factor is that we are in a system where, see, it makes me feel really good if I tell you, okay, it's all done, you're great, life is good, I've fixed you, Abdina. So, I'm very, very careful about using those terms, because the reality is there is no, I'm not making the heart, no human being on planet Earth is making the heart back to like when they were 15, okay? So this is a fix. But then I think we also should take time and effort to educate our patients about the importance of what they do after they leave the hospital, and that they are in control of their destiny. ங்கிறது ரொம்பவே முக்கியமான ஒரு விஷயம். ஏன்னா see, what happens is that memories fade. ஹார்ட் அட்டாக் இருக்கும்போது I'm scared, அது இருக்கு, ஆமாம். But if I don't take the time and effort to tell the patient, hey, this means a lot. I'm saying, I'm kind of fixed it, right? So இனிமே நான் இதுக்கு மாற்றணும், நல்லா தானே இருக்கு, I can go back to my whatever. And so so I think people can still choose to make bad decisions, but at least we should do our part.
Yeah, to educate them. So post cardiac rehabilitation.
Yeah, it's super important. Super important.
So is there a limit to the number of stents you can place? Exactly. You see blocks here, there, everywhere. So do you stent everything? How many have you done in one sitting?
So I'm an options guy. I like my options. So usually I stent areas where, see, just like I said, bypass can fail. Stent can, like, what if this patient just has this predisposition to having restenosis, right? Despite everything. ஸோ ஜென்ரலாக எனக்கு I don't like to stent areas which a surgeon can graft. So LADங்கிறது ஒரு and see surgeons can access, again this is very technical, but surgeons can access only certain parts of the heart when they put grafts. So, and I think most cardiologists know that, right? So you don't want to stent areas where generally, if it's a future option, I don't do it. Because there are other therapies too. There are drug-coated balloons, etc. And stent போடுறது in general, I mean, at least the way it used to be, is like getting married. It's a commitment. You're taking out a stent is really hard. So you don't want to stent if you don't have to. So the number, and don't get hung up on the number, because see, stents are like building blocks. So sometimes ஒரு லாங் பிளாக்கேஜ் இருந்தால் 2 ஸ்டென்ட் போட வேண்டியிருக்கலாம், சைஸ் மிஸ்மேட்ச் இருந்தால் 2 போட வேண்டியிருக்கலாம். அல்டிமேட்லி ஃப்யூச்சர் ஆப்ஷன்ஸ் பர்ன் பண்ணக்கூடாது, அண்ட் ஹார்ட்டுக்கு பிரச்சனை இல்லாமல் எல்லா இடத்துக்கும் ரத்தம் போகணும். இதுதான் கோல். ஸோ யா, ஐ மீன்
numbers are not
the devil is in the
really,
details, yaar. So I can't give you இவ்வளோ நம்பர் போடலாம், 4 ஸ்டென்ட்டுக்கு மேலே போட்டால் உயிருக்கு இது சினிமாவில் தான் அப்படி சொல்ல முடியும், ரைட்? யா.
like that. Okay. So what is CTO, your specialty specifically, and why is it really difficult?
So we talked about a sudden blockage, right, in the heart. So that's a heart attack. Sometimes what happens, and you kind of, when I think we were talking about Ashok, you talked about collaterals, etc. So sometimes what happens is that or a blockage either gradually build agum illa they may have had a silent heart attack, but for good luck they may have some collaterals. Adha the natural bypass nu solluvaanga. At least it used to be the term.
Block irukku, and the block
ana and the block தாண்டி
the blood vessels sprouting and serving.
It's not blood vessels are not sprouting. அங்க இருக்கிற blood vesselக்கு மத்த சில blood vessels give some குட்டி creepers மாதிரி குட்டி things போயிட்டு அந்த பகுதியை உயிரோட வச்சிருக்கும். Now the விஷயம் என்னன்னா, it's getting enough blood at rest. ஆனால் இப்போ ஜஸ்ட் லைக் ஒரு 80% பிளாக்கேஜோ 90% பிளாக்கேஜோ என்ன பிரச்சனை அப்படின்னு பார்த்தீங்கன்னா, ஹார்ட்டுக்கு ஒரு பயங்கர ஒரு இன்ட்ரெஸ்டிங்கான விஷயம். இட்ஸ் ஒன் ஆஃப் த இட்ஸ் வெரி யூனிக் ஆர்கன் இன் தட் பிகாஸ் இட்ஸ் ஒர்க்கிங் ஸோ ஹார்ட், இட் எக்ஸ்ட்ராக்ட்ஸ் மேக்ஸிமல் ஆக்சிஜன் எவ்ரி டைம், like with even at rest. So the only way you can get more oxygen is by increasing blood flow. So it's a very flow dependent organ. So ஒரு 90% blockage இருந்தா நிறைய பேர், again I'm digressing but there's a reason, ஏன் அவங்க நடந்தால் எனக்கு நெஞ்சு வலிக்குது நின்னா போயிடுதுன்னு சொல்கிறாங்கன்னா, ஏன்னா நடக்கும்போது இன்னும் ஆக்சிஜன் வேணும், அதுக்கு இன்னும் blood போகணும். ஸோ 90% blockage will affect blood supply during stress or when I'm active. இதே போல தான் CTO. ஸோ இந்த குட்டி கொலாட்ரல்ஸ், இந்த நேச்சுரல் பைபாஸ் 100% பிளாக்கேஜ். க்ரானிக்னா ஒரு 3 மாதங்களுக்கு மேலே, டோட்டல்னா 100% அக்ளூஷன்னா பிளாக்கேஜ். ஸோ இதை தாண்டி உயிருடன் இருக்கான அந்த ஹார்ட் மசில், இட் ஸ்டில் நீட்ஸ் பிளட், பிகாஸ் இஃப் இட்ஸ் டெட் இட் டசன்ட் கேர். It still needs blood, and the blood is coming through these kutti collaterals. So restla இருக்கும்போது they're okay, but கொஞ்ச தூரம் நடந்தாங்கன்னா, just like a 90% blockage, it will lead to symptoms. Now the other big issue is, இன்னொரு குழாயிலேருந்து தான் இதுக்கு சப்ளை வருது. ஸோ இப்போ 3 டயர் இருக்குது, ஒரு டயர் போயிடுச்சு, இந்த இன்னொரு டயர் வந்து கைண்ட் ஆஃப் குட்டி ஸ்பேர் டயர் மாதிரி இங்கேருந்து அனுப்பிச்சு ஓகேடா உயிரோட இரு அப்படின்னு சொல்லிட்டு இருக்கு. ஸோ இப்போ அந்த டயரில் பிரச்சனை வந்துச்சுன்னா you're hitting 2 vessels. So it becomes an even bigger hit. And there are studies that have shown this. முன்னாடி ஒரு CTO இருந்த ஹார்ட் அட்டாக் வந்துச்சுன்னா their likelihood of making it is much lower. So CTO பண்ணுவது, ஸோ CTOங்கிறது chronic total occlusion. It's a blockage. It's a 100% blockage. இதை திறக்கிறது ஏன் கஷ்டம்னா, சடனாக ஹார்ட் அட்டாக் லைக் பிளாக்கேஜ் வரும்போது இட்ஸ் சாஃப்ட். ஒரு வயர் போட்டிங்கன்னா போயிடும், அந்த பிளாக்கேஜை தாண்டுறது ஈஸி. அப்புறம் பலூன் அது இதெல்லாம் செய்யலாம். நாங்கள் பண்ணுற அனைத்து வேலையும் இட்ஸ் ஓவர் வயர்ஸ். We are glorified plumbers, okay? ஸோ பண்ணுறது எல்லாமே ஒயர் வழியை பண்ணிவிட்டு தாண்டிட்டு தான் பண்ணோம். 3 மாதங்களுக்கு மேலே, சில வருடங்களுக்கு மேலே பார்த்தீங்கன்னா இது சிமெண்ட் மாதிரி ஆகிடும். இட் பிகம்ஸ் ரியலி ரியலி ஹார்ட். ஸோ அதுக்கு இங்கே பாயிண்ட் A to பாயிண்ட் B நான் தாண்டினா தான் பலூன் பண்ண முடியும், என்ன வேணாலும் பண்ண முடியும். ஸோ அதை தாண்டுவதே ரொம்ப ரொம்ப கஷ்டம். ஏன்னா யூ கோயிங் த்ரூ ஸ்டோன் ஆர் சிமெண்ட்னு வச்சுக்கோங்களேன். ஸோ அதுக்கு சில ஒயர் வந்து இன்னும் தே பெனிட்ரேட்டிவ். ஸோ அதுக்கு மல்டிபிள் டெக்னிக்ஸ் இருக்குது. ஸோ அண்ட் இன் ஜென்ரல் எங்கள் ஃபீல்டில் பொறுத்துக்கிட்டிங்கன்னா திஸ் இஸ் கன்சிடர்ட் லைக் the 36 chamber or shawl, and like only the a CTO expert should be really comfortable and a master in all the other techniques, imaging, bifurcation, graft, left main. I mean, like I can throw a dozen terms, but this is finishing school. So, and it's very hard technically. So, yeah.
It is difficult.
Yeah,
but
it's doable. So, in today's day and age, again, like, technology, techniques, there are like lots of techniques that we can use. So, munpurama po mudlana, pinpurama pola, retrograde na solvo. You can get into the vessel wall and re-enter. In fact, yesterday, I did a case just like that. So, it's very much doable. ஒரு காலத்தில் bypass was the only option. Say someone had symptoms on medicines and they just couldn't பண்ண முடியல 100 அடி நடந்தால் நெஞ்சு வலிக்குது. ஸோ அப்போ கிராஃப்ட் மட்டும் தான் பண்ண முடியும். ஏன்னா அந்த 100% பிளாக்கேஜை தாண்டி ஒரு bypass போடுறது. இப்போ ஆனால் I would say it's, if they can put a graft, we can pretty much open it.
Yeah, in the right hands,
Yeah.
it is pretty much unblockable. அப்படின்னு எதுவும் இல்லை.
And it is unblockable.
It is, sorry, it is not unblockable now.
Oh, that's it.
Double negative.
இல்லை உங்கள் டைட்டில் மாதிரி it is unblockable. You can unblock almost any blockage.
Yeah. So you were talking about bypass and you said bypassங்கிறது block-ஐ வந்து தாண்டி இன்னொரு they attach a graft and then divert the blood flow beyond the block. Is that correct?
So yeah, and again I think this understanding is very important because many times people think bypass surgery na அவங்க திருப்பி வந்து எல்லாத்தையும் புதுசாக bypass road போடுறாங்க. It's not like the entire circulation is bypassed. So என்னன்னா ஒரு இடத்துல அடப்பு இருக்குன்னா it's literally like அந்த ஜங்ஷனை தாண்டிட்டு அதுக்கு மட்டும் ஒரு bypass மேலேருந்து அந்த அயோட்டாலேருந்து செய்து they take the இடது மார்பு left breast supply பண்ணுற blood vessel லீமா இல்லைன்னா கால்லேருந்து சம்டைம்ஸ் நரம்பு எடுத்து பண்ணுறான்னு சொல்லுவாங்க வெயின் எடுத்து. So they reverse it and then they basically attach it to the aorta and then to the coronary vessel beyond the blockage. Idea என்னன்னா mechanically you have to restore blood flow to the heart. So angioplasty, bypass இதெல்லாமே mechanical interventions to restore blood supply.
And that's open heart surgery.
Yeah, bypass is open heart surgery. Angioplasty, stenting எல்லாம் வந்து minimally invasive. Yeah.
Can heart disease be prevented?
That's the goal. I mean, I think, the answer is yes. It's not 100% preventable, but it's definitely, we can do a lot of things to reduce the risk of us having a heart attack.
So now that you have said that heart disease can be prevented and you were talking a lot about lifestyle having a lot to do with the risk factors as well as being the initial part of any treatment regimen. So can heart disease be reversed with lifestyle changes?
Again, that's the holy grail. So once you do have blockages, there are some studies which have shown that early stages it can be reversed. Now, I think again, lifestyle can be helpful. Konja advanced aachna, it's like a pyramid, right? Oralukku mela taandichna, aggressive, like for example, statins controlling your risk factors can cause some regression in plaque. Adhe pole there are some newer medications like PCSK9 inhibitors அப்படின்லாம் இருக்கு. இதெல்லாம் இன்னும் கூட கொலஸ்ட்ராலை ட்ராப் பண்ணும். So these can help. But see, ultimately what you want is that a lot of people have blockages. Not every blockage needs a stent or bypass. It's about having good quality of life and to prevent fatal things. Like, எனக்கு heart attack வரக்கூடாது. அதுதான் goal. So even if I can cause stabilization of the plaque, etc., அது கூட good தான். So yeah, lifestyle, early stages, it can be reversed. Can help reverse heart disease.
So diet பத்தி பேசும்போது from the point of view of being heart healthy on a score of 1 to 10 or you can go 0 minus about 10 also.
So this is a tough one, but I'll try. Okay.
Avocados.
8.
Ghee.
0 to 1.
You have to also say that it does have to do with the quantity, right?
So I'll say that in the end, right? I mean, anything, right? Alavukku ponal amurdamam visham.
Coconut.
Yeah, coconut itself is not terribly bad. It's like I would say 3-4.
Sunflower oil, heart healthy.
In general, all oils are bad. So yeah, this heart healthy is kind of a big myth. And anything if you fry, it depends on how you take the oil. So just go on this. If you fry anything in oil, it's not good. Oil oils are pretty much bad. And then, sunflower oil I would say is probably 2.
Extra virgin olive oil, not fried, sprinkled on your salad.
So that's the one oil that I would say, Thank you for that. So saladல நீங்க வந்து add பண்ணிக்கிறீங்கன்னா I would say it's probably a 6 or a 7 or 8.
Walnuts,
9.
beetroot,
9.
eggs,
4.
egg white,
5.
red meat,
I can go negative, right?
Yes.
-5.
legumes,
9.
whole grains,
9.
potatoes,
3.
sweet potatoes.
5. The important thing with all these arbitrary scores that I just said was depends on how you consume them, how much you consume. So yeah, take that with a pinch of salt. So it's kind of a fun exercise, but in general, less processed, more whole food plant-based stuff is good. Extra virgin olive oil is good in limited quantities. Remember, it is pure fat.
Coming to exercise, which do you think is the best exercise for the heart?
So the guidelines, if you take what the guidelines say and what most most of the experts would probably agree on is you should have some degree of aerobic activity, and you should at least aim for about 30 to 40 minutes 5 days a week, right? Now, if you want to do what is most optimal, not just for the heart but for overall health, I would say incorporate some strength training. I think increasingly we are realizing that there are various components in exercise, as I'm sure we know. As we get older, like 40 plus, we all should be doing strength training because loss of muscle mass will overall affect your longevity. So I think strength training is pretty important, at least I would say 2 to 3 days in a week. Throw in some aerobic activity for sure, maybe like 3 days in a week. I think flexibility, posture, balance, these are things that are not glamorous, but I think it's very important. And definitely stretch yourself before strength training so that you don't, and make sure you have enough recovery so that you don't end up hurting yourself. This is more for people that are 40 plus. Like in your 20s, you recover from injury. Your 40s are not kind.
Tell me about it.
Yeah, right. So we definitely want to take time and do it properly.
ஸோ நான் தான் வாக்கிங் போகிறேனே டாக்டர், அப்புறம் என்ன அது பத்தாதா? வாக்கிங் நான் டெய்லி ½ hour போகிறேன்.
Actually, that is very good. I'm proud of you. பண்ணிட்டு இருந்தீங்கன்னா. So daily brisk walking 30 minutes in a day is actually really, really good. And that's probably better.
தெரியாது.
Even if you're walking, it's probably better than 90% of the population, right? So that itself, so kudos to you. But now that you've come this far, maybe you can do a little bit more. So, and in fact, this is something that I even tell my parents, right? Because, see, nobody is used to like strength training. I'm like, hey, enga tata paati illa apdi dhaan pannangala appadina. But like, I think, bone mass, muscle mass, ellame korayama irukradhukku, I think strength training is important. I mean, we're not saying go hardcore, go to the gym, etc. But at least light weights. Make sure you keep doing that. But I mean, kudos to you if you're doing 30 minutes of walking every day.
Okay, that's at least better than
that's definitely good. Definitely good.
ஆனால் நீங்கள் ஐம் கிளாட் யூ செட் ஜிம்முக்கு போகணுன்னு அவசியம் இல்லை. ஜிம்முக்கு போகிறவங்க எல்லாம் அதே சடன்லி ட்ராப்பிங் டெட்ன்னு சொல்லிட்டு காமிக்கிறாங்க நியூஸில், பேப்பரில் எல்லாம் சொல்லிட்டு. அப்புறம் அந்த மாதிரிலாம் ஸ்ட்ரெனுவஸாக அதுவும் 40க்கு மேலே நம்ம எக்ஸசைஸ் பண்ணால் ரிஸ்க் தானே ஹார்ட்டுக்கு?
No, that's so. I mean, this actually is very important because a lot of people do ask about this, right? Doctor, gym போகிறதுனால தான் சாகுறாங்களா? அதுக்கு நான் பேசாமல் வீட்டிலே நீங்கள் சொன்ன அதே தான், அதுக்கு நான் தம் அடிச்சுட்டு வீட்டில் உட்காந்துருந்தா பிரச்சனை இல்லைல்ல அப்படின்னு. So I think there are two things that we need to like really focus on. Number one is if you have always been sedentary and if you've had underlying disease, suddenly going and working out is a big risk factor, right? Because you may have underlying disease and you just haven't picked it up. You may have hypertension, you may have cholesterol, we don't know. We just think we're healthy. So please get a checkup if you're over 30, I would say, in our Indian setting, before you start working out. Number two, listen to your body. And as you know, perceived exertion gardu rombave mukkiyamaana oru vishayam. There is a way for us to know. There's a scale for this. There's a Borg scale, there's a modified Borg scale, etc. So without getting into the details, what I would say is that the modified Borg scale actually goes from 0 to 10. 10 being like extremely, I'm like killing myself, and 0 is like, hey, I'm doing nothing. Get in tune with your body. Like if you know you're pushing too hard and you need to back off. Or if you're like, hey, this is a walk in the park, I can do more, abdina pannunga. Now, the one thing I would say with the gym trend is if you do have symptoms when you're doing it, let us say you ignore everything that I said, please take home this one point. If you are experiencing symptoms, meaning ரொம்ப மூச்சு வாங்குது எனக்கு, stop. your gym trainer is not most likely not a qualified medical professional. அப்படிதாங்க இருக்கும் நீங்கள் பாட்டு பண்ணுங்க, especially if you have risk factors. Please listen to your body. I think it's super important. And of course, stating the obvious, I've said this umpteen times, six-pack is not really healthy. Don't abuse drugs just out of vanity.
And the thing you said, if it's an unusual symptom, which is very new in you, that's the exact thing Ashok told me. He goes to play shuttle every evening. And that evening, he said, it's a different kind. I can't explain it. This is something which I have never had before. That feeling of air hunger, maybe. And then he stopped and then he said, okay, let me just get an ECG with a friend just to be on the safer side. So that's how he exactly described it, as it is something which I've never felt before. So if you're feeling anything unusual, so probably I think you should just back off and get tested, as you have pointed out also.
And I'm actually really happy that you're sharing something so personal with the viewers. And obviously, must have been a very traumatic time. But the key message, guys, is like it can happen to anyone. And for those that don't know him, he's way more athletic than like I think most of us. And so it can happen. So if you are noticing something different, I think it is very, very, very important that you back off and not try to just push through it.
Sleep, is it important for a healthy heart?
Yep. It's something that I think, I personally have the most trouble with.
How
Since
many
we
hours
are
a
in this
day?
thing of like opening up and telling people,
How many hours a day do you sleep?
I'd say like, I try to shoot for 7 hours, 7 hours of good sleep. It's really a challenge with my lifestyle, like, to get to bed early because I'm like, that's one of the things that I'm working on. It's a work in progress. It's really important. And I think sleep is our hidden superpower. It really helps the body recuperate. Because we make bad decisions when we are sleep deprived. We get crabbier, we get we eat junk. We don't have the motivation to exercise.
So it's all domino effect. So one thing sets off the other, I'm sure.
And independently, it helps.
Substance abuse, smoking and drinking. I think you have covered smoking quite a bit and said that that's the first thing you could stop if you wanted to do something good for your heart. What about alcohol?
No, this is very interesting because I think the pendulum has swung. So there was a time when people thought like, okay, alcohol. And again, if you look at data, just pure data, up to moderate intake of alcohol, like cardiovascular protection, even hardly. Then they were talking about resveratrol, like in red wine, to help the heart, etc. So the party line and the recommendation was, again, no gender discrimination, but 1 glass of wine for a woman and 2 for a man, and again, appropriately sized portions. And you can't like overcompensate. But increasingly, right, there's more and more data that, and the reason why doctors don't say, oh, have a glass of red wine as a prescription is because there are other things that go with alcohol. It increases your cancer risk, increases your overall mortality risk, etc. So, I mean, there's no health benefit, and the perceived, the benefit that you get from red wine and all the antioxidants, etc., you can get in half a dozen other things. So if you're deluding yourself into saying, okay, I'm drinking because it's good for me,
health,
quit it. But yeah.
Social connections in an increasingly online world.
So, social connections are very, very important. Again, kind of stating the obvious. We've all become very isolated increasingly, and I think most of us are in love with our cell phones. But that does not actually, that's not really a good connection. The number of followers or friends that you have on Facebook, Insta really doesn't matter. I think you should have a place to unwind. You should have people friends or family that you can actually have dinner with together. I think it's really, really important. Because I think, for our mental health, and what we are realizing is that your mental health and your heart health are very, very, they're intricately connected. So, you can't just be like, hey, I work out and, I do all these things right, but I mean, I'm just not happy. So being happy matters. And I think social connections are very important for you to be happy.
important for your heart health
Among a
also.
happy heart.
Stress and heart health.
So that's the other side, right? So if you're happy, usually it's very hard to be stressed. I mean, it's very, although there is like positive stress, but like for the most part, um, everyone, like almost all the young patients that I see, usually if it's the husband that's the patient in their 30s, the wife says அவருக்கு ரொம்ப stressful jobங்க எல்லாத்துலேயும் ஸ்ட்ரெஸ்ஸுங்க அப்படின்ட்டுனா I think we have partly, I think we're kind of doing it ourselves. Not everything has to happen now. I think we really should be more purposeful, try and slow down a little bit, etc. It's very hard. So, but like I think effective stress management techniques is not something that we are born with, because and again, truthfully, I have ended up picking in my career things which are more stressful every time. Every time. My dad told me, don't get into cardiology, it's stressful. I got into cardiology. Other interventional, he was like, do you want to go in the middle of the night when you're in the US? Like for STEMIs, I said, yep. Then I chose to do CTOs. I want to be a global expert in that. So everything adds stress. But the only way you can do it is, you have to learn how to manage it. Don't take your stress home. And like, see, natural, someone is dying. You're going to learn breathing techniques. If you enjoy Friends, that's a way, that's a stress buster. If you like dancing, do it. Do things that give you pleasure. Have some me time. Take care of yourself. And learn, like, talk to people about how they manage stress. I think it's an acquired skill set that we have to master.
Yeah, and it's going to be different for
Each person, yeah, it's got to be tailored to you.
Is it really possible to have a broken heart? Is there something called a broken heart syndrome, or is it only, for those who are whatever?
No, guys, it's true.
Loved one.
It actually can, but contrary to popular belief, it does not necessarily happen to young women or men because their loved one ditched them. That's not the way it works. I mean, it can, but the classic, it can happen, and actually, it kind of emphasizes the brain-heart connection. So when you have an extremely stressful, like say, a loved one passes away, I'm actually had an old lady who came in with the broken heart because her cat died. This was in the US. So, and she was very attached to it, died, and she had, it mimics a heart attack. Now, the difference between a broken heart syndrome and a heart attack is that when we did the angiogram, her vessels were clean. Actually, the heart takes a very specific appearance to, the heart actually becomes weak. ஸோ நம்ம நார்மலாக அந்த எஜெக்ஷன் ஃப்ராக்ஷனுங்கிறது எக்கோவில் பார்க்குறது 60-65% இருக்கணும். 100 ml வந்தால் 65 ml போகணும். ஹர்ஸ் வாஸ் பம்பிங் அட் லைக் 30 ml. ஸோ இசிஜியில் மாற்றங்கள் இருந்துச்சு. எவ்ரிதிங் வாஸ் தேர். பட் when you get a history, she's my cat just died. And this is a recognized phenomenon. So the emotions can actually do this to you. So it's a very real thing. But the good part is that with medications and with just supportive therapy, many times, most of the times, your heart recovers. The heart is forgiving. Yeah.
Counseling for the broken heart.
Yeah,
and the
counseling
mental
and the
part.
right medicines and all this stuff.
Are there any supplements which you would advise as a cardiologist to help with heart health?
Probably almost every viewer is vitamin D deficient. I've not seen a patient that has not taken supplements who has normal vitamin D. It's just ubiquitous. And low vitamin D actually puts you at higher cardiovascular risk. So definitely vitamin D. And I would also say omega-3 supplements is probably something that நம்ம நியூட்ரிஷனில் ரொம்ப இல்லை. ஸோ தோஸ் வுட் பி 2 things. Vegetarians எடுத்துக்கிட்டிங்கன்னா மேபி take B12 and folic acid in just because sometimes homocysteine either increases இருக்கலாம். But check those levels.
So let's go on to the rapid fires. The final part of the podcast for today is heart disease still the number 1 killer in India?
Yeah.
Both in men and women?
Yes.
Can young people in their 20s get heart attacks?
Unfortunately, yes.
What was the age of the youngest patient you have treated?
22.
Oldest patient you have successfully treated?
102.
Wow. Give friend or foe for your heart.
4.
Is walking 30 minutes a day enough for heart health?
It's acceptable for heart health.
Are palpitations always dangerous?
Not always, no.
There are certain physiological conditions where it may be normal, but it's always better to get it checked.
If you have it frequent, if it's bothersome, associated with other symptoms, then you should.
Can anxiety mimic a heart attack?
Unfortunately, yes, it can.
but you can't
and a
make out
panic
the
attack.
difference.
Yeah, I mean, literally, right?
Can you can't
And a
make out
panic
the
attack.
difference.
Yeah, I mean, literally, right?
Can yoga lower blood pressure?
Yeah, it can.
Is family history a guaranteed predictor for heart disease?
I mean, it's like everything else. There are no guarantees, but it definitely can play a very strong, it can be a very strong risk factor.
Heart healthy oil.
Extra virgin olive oil, if it's not fried, I mean, if it's used moderation.
Sparingly.
Yeah, sparingly.
One food you would ban for the sake of the heart if possible.
Sugar,
One food which you would include every day if possible.
spinach,
One thing which you would never do as a cardiologist.
smoke,
One thing which you do every day as a cardiologist.
exercise.
Are smartwatches reliable for monitoring your heart?
Yeah, I mean, for your heart rate, steps, etc. But it's not a complete package.
What do you find different between practice in the US versus India mainly?
Oh, there's a lot more rumors and myths here, I think. And overall, I think, US, it's like 5% of patients get a second opinion. Here, I think like 80% of patients get a second opinion.
Because it's easily accessible.
It's easily accessible, and in general, many times there are divergent opinions, so they just go by consensus. So it's really hard, I think, sometimes for patients here.
What should people check before starting any exercise program?
Depends on the age, but definitely they should know their risk factors, and to an extent, they should know, their work capacity. So check with your doctor before you embark on any strenuous exercise program.
Your top tip for a healthy heart?
I think pretty much it's the whole package.
So all the lifestyle measures.
All the
we
lifestyle
have,
stuff.
discussed.
I would say know your risk factors. I would say that's probably the biggest thing.
So are you scared for the next generation, seeing what you do?
Not really. I think, we have kind of hit rock bottom. I'm kind of actually fairly optimistic about it. I think, most people are smart. So, yes, there's a lot of information, there's a lot of stuff. But I think, when the dust settles, people know what to look for. And I have faith. I have faith in humanity. Yeah.
So that's good. Let's end that on an optimistic note, at least, and a positive note. So thank you so much for spending so much of your valuable time. And I think we have covered a lot of the basics of heart health in today's episode. So thank you for your time.
No, thanks for doing this amazing podcast where you bring in a lot of people. And I think it's very educational, hopefully.
So we have spent this episode learning the in and out of the one thing we often overlook, the steady rhythmic pulse that powers our every move, every dream, and every second of life. The heart never asks for applause, it doesn't demand attention, but when it's in distress, it speaks loud. Listen to it when it whispers rather than when it screams. What today's conversation reminds us is simple yet profound, that just like the heart nourishes itself first before serving the body, we too must learn to prioritize our well-being without any guilt. Check in with your heart, not just at the doctor's office, but in the quiet choices of daily life, the food you eat, the sleep you skip, the stress you carry, and the joy you forget to feel. Because this incredible organ doesn't ask for much, just that you care for it the way it's always cared for you, a beat at a time. Until next time, stay curious, stay kind to yourself, and as always, let's keep the conversation going.